Hello, everyone. Nice case I want to share with you. This is what the X-rays of referral dentist, and dentist start to work with tooth 26. You can see some radiolucent area. The tooth was symptomatic, percussion and palpation was positive, and dentist tried to start the root canal treatment. And after this X-ray, he understood that he did some perforation during looking for MB2 canal, and the third case for me, it was a letter that during looking for the MB2, some perforation was created. Please complete the case. I started to check the case. First of all, I did my own X-ray. It's important point. Always do your own diagnostic X-ray because you have no idea about exact work of previous dentist. And what can I see? I can see in radiolucent area near the palatal root, radiolucent area near the buccal one, some radio opacity, radiopaque material in pulpal chamber, maybe with some perforation, maybe yes, maybe not, and positive palpation, positive percussion, no pockets, important part of the story, no sinus tract. The final diagnosis was previously initiated treatment and symptomatic apical periodontitis. And I started to work, and I was shocked to see the situation because we see here not small perforation biofile in area of MB2, but we can see here a huge perforation of pulpal floor. What you see is the bone, and maybe some areas of file introducing in this bone. And first of all, what I started to do to flush its way as anal cell, because we have the infection here. It's, by the way, no fear of anal cell accident. Anal cell accident always linked to injection of anal cell over the apex. And here with this huge perforation, no real fear of anal cell exists. And little by little, I started to look for the canal, and finally, I found the mesobuccal one and distobuccal one. The palatal was already found by the dentist, previous dentist. And to tell you the truth, I decided not to look for the MB2 because all mesobuccal area was so destroyed that I tried to understand what will be better. And I think my approach to look for may be much more aggressive and destroyed more this teeth. In the end, I did X-ray of working length determination to check the apex locator data, and I prepared canal to number 30, and I put calcium hydroxide not just inside of the canal, but first of all, I put calcium hydroxide on area of this perforation, not in a creamy mix, but much more, it's like for apexification. And you see really thick paste calcium hydroxide. With calcium hydroxide, of course, I continue to work against the microorganism, but also I create a condition to increase pH in this area, because of course next visit I decided to use some 3-calcium silicate cement. And 1 month later, no pain on percussion, no pain on palpation, and again, very important, no poking around. And I put BC putty after flushing the calcium hydroxide, and now you see again the X-ray with my instrument to check that I didn't push some BC putty inside of the canal, and you can see here in BC putty in area of perforation. And after I finished my treatment with gutta-percha and BGM root canal sealer, this interesting epoxy sealer with macromolecule that prevent biofilm formation, I put glass ionomer, I put my temporal filling, and I give a strong recommendation to dentist to finish with post-endodontic restoration without post, and to put a crown. Here again, you can see my final X-rays in 2021, and a couple of days before I saw the patient 2 years after. It was very nice to see that everything is okay. And first of all, palpation minus, percussion minus, no pockets, no sinus tract, no radiolucency in furcation area. Also, what you can see, some healing process on palatal root, but on distal buccal, you almost don't see the healing. Okay, please see the initial X-ray diagnostic one, and now on palatal root we can see healing, on distal buccal not. Why? Because you can see that I did some overfilling, and as we know, overfill can decrease the velocity of healing. It's okay. The most important, the tooth asymptomatic, and the apical radii didn't grow and didn't enlarge. And of course, I will continue my follow-ups, because we know about peaks of healing 6, 12, 24, and 48 months. And of course, I hope it will be possible to me to put here after 2-3 years additional follow-ups. Thank you for your attention. Have a good day, guys.